So let's talk about FMT capsules, or poop pills. FMT capsules are minimally invasive, safe, and actually rated as patients' preferred mode of administration. Research has shown that FMT used to treat recurrent C. diff is highly effective and safe, comparable to colonoscopy, the current gold standard, with both showing comparable success rates of over 90%. FMT capsules are reported to have some mild, transient gastrointestinal symptoms, including things like diarrhea, bloating, and abdominal pain, but these pass on their own without any need of intervention. Adverse effects for FMT capsules are actually lower than any other mode of administration. Overall, FMT capsules may allow for FMT to become a more accessible and aesthetically pleasing treatment option, and may even become the standard of care when talking about FMT.